Amid the worst pandemic that the world has faced in the last 100 years, the capitalist profit machine continues to roll on, making profits regardless of what injury it causes to anyone. And the latest manifestation of this is in the hospital system in the United States. Currently, there are numerous people out of work due to COVID pandemic. This has been going on for over a year. Millions of Americans have been put out of work due to illness and governmental lockdowns to prevent the spread of COVID. Now, due to the limited ability of working class and even some middle class people to pay their debts, Community Health Systems, a chain of hospitals in the United States, is suing 19,000 patients for unpaid hospital bills. A CNN review of CHS's court filing across 16 states found that the chain has sued patients for as little as $201 and as much as $162,000. CHS told the network that it only sues patients as a last resort. Though the lawsuits were filed during the pandemic, they typically cover medical treatments provided years ago. Now, CHS says that they don't sue patients who have lost their jobs due to COVID, yet they very much have continued to do so. They say that they also have a policy of not suing anyone who makes less than 200% of the minimum wage. In other words, if you make about $25,270, if you make less than that, apparently they don't sue you. However, we should not confuse this for compassion. According to CHS, people frequently don't have the financial resources to engage in a court battle, so they end up having a default judgment against them. These non-battles, plus court fees and lawyers' fees, bury the individual with impossible debt, while they're already suffering from a job loss due to COVID. As if this weren't bad enough, at least a dozen people were contacted who have been sued by CHS, and they say that the lawyers and the hospital itself were unwilling to come to some kind of reasonable payment system or reasonable payment amount that they could actually afford during this difficult time. In other words, they say that CHS was unwilling to work with them in order to be able to pay the debt. According to a study done by Johns Hopkins University, the CHS owns 9 out of 10 of the hospitals who sue the most patients in Texas. CHS denies this, but offers no real concrete reason. Now, CHS is in absolutely no condition to complain. They made $511 million last year from the COVID pandemic. Now, how did they make so much money? Because what's important here is the fact that they had made losses the last 4 years, and then during the last year, they're up $511 million. Well, you see, part of that is the fact that they took money from the U.S. federal government in terms of subsidies for trying to boost up the healthcare system in the United States in order to cover its debt. At the same time, it also gave record high bonuses to many of its executives. Now, these bonuses have been registered with the Securities and Exchange Commission by CHS itself. So it's not something someone is making up. It's down there in their own paperwork. So far, they've gotten $705 million in money from the CARE Act, which was designed to help hospitals deal with the upsurge in COVID patients. So they're really in no condition to complain about not having enough money. They've already made a profit of $511 million and with enough left over to give record high bonuses to their executives who don't seem to have done anything but screw up the last 4 years of their profits. I mean, to me, as a Canadian, someone standing outside of the system, this is absolutely reprehensible. As a citizen of the world and a person, this is reprehensible. They know very well that even if this medical debt is from years ago, people can't afford it right now. People can't afford anything right now. In fact, there is a severe shortage of effective demand for goods and services because people are out of work. Now, those numbers are starting to turn around now that there's an increase in employment and a lot of the restrictions in a lot of places are being turned down, some of them very unwisely, but regardless, they are happening. Employment is very, very far from being where it was before the COVID pandemic happened. And employment in the United States still hasn't even reached pre-Great Recession 2007 levels. This has been a continuing downtrend in capitalism. And of course, as usual, there is the hospital system ready to suck up as much profits as it can, like the parasites that they are. And that's my straight up opinion of them. You don't even have to be a Marxist to acknowledge even the bourgeois economists who know very well and do speak to that a universal healthcare system is more cost effective, it's more efficient, and it leads to a better standard of health for the average citizen. Believe it or not, when people are healthier, they're more productive as workers, which is why bourgeois economists generally do support the idea of a universal healthcare system, because it is what's most efficient for society. And that's kind of the definition of the word economics, and rather the definition of the field itself. But still, even as people are suffering, and they are still suffering despite what little recovery there's been, the hospitals are still there to suck up as much profit and sue people, try to destroy their lives. Because one of the biggest reasons for people declaring bankruptcy in the United States is medical debt. And yet still they show no compassion or sympathy whatsoever, because of course that's capitalism. Capitalism isn't there to make your life better, it's there to make money. And it's not always going to do what's rational in terms of human life and dignity and human rights. It only does what's rational in terms of profit making. But isn't this something everybody already knows by now? That apparently everybody but the United States seems to understand? Well, that seems to be the one major struggle for the American people. And the one thing that the U.S. government could do to buy off first world workers to an even greater degree. The one best thing they could do would be to create a universal healthcare system. I mean, the money's there. Maybe slash 1/10 or 5% of what's in the military budget. And it would be perfectly affordable, and it would be more efficient than the system that exists now. But that's not the point of the United States. The point of the United States is not to take care of its people. The people in the government are representatives of the bourgeoisie, and the point of the bourgeoisie is to make money. Thank you for watching. If you like this program, then please head over to my Patreon page and set up a monthly donation. It's your donations that keep this program running. Also, if you would like, please rate, comment, subscribe, and share in various social media.